NCH began the patient-centered model of care pilot program at the Baker Hospital campus in June of 2018. We expanded the program to the North Naples Hospital campus in August of 2018. Our nurses and our staff at the front line who spend the most time with our patients are eager to share their stories of how the quality of their care has been impacted through this pilot.
As opposed to like in the past where if you needed orders changed, you gotta call the doctor's beeper, go through their service, wait for somebody to call back, and you need a response now. The doctors are here. You know, I can walk up to a doctor and say, hey, this is what's going on with this patient today. Can we do this? Can we do that? Can we change this order, add this modality? And you have an immediate response, as opposed to maybe somebody gets back to you at the end of the day. This is for the patient. It's not for the doctors. It's not for the therapy people, allied health. This is strictly for the patient so that we can get them what they need, when they need it, and get them home.
For the general public that may not have a doctor, an individual doctor in the outpatient setting, this kind of gives them that attention when they're in the hospital, that they have that doctor that's at the bedside, outside, that the nurses have access to, and it's just a great resource for us and for our patients.
In all my years of nursing, this has been the best. This works. The people are happier, and my nurses are happier.
With the pilot program, our doctors are here. We have multidisciplinary rounds in the morning. The doctors are there. We ask our question, you know. My patient need a replacement of her electrolyte, it's low, or, you know, they're right there. I ask, I get my order. Physical therapy is there. Are you coming to see my patient today? So I can wait for them if they need to do an evaluation. There are times when we get a patient up only to walk out the door and here comes physical therapy wanting to do an evaluation, and we just exhausted our patient, you know. So this way we get to coordinate care.
Everyone is involved. So you've got your respiratory there, the doctor is there, we've gotten those orders, and it's much quicker than trying to call an office and get those same orders. The doctor can't see the patient, so he's only having to go by what the nurse is saying, whether it's myself or the primary nurse that's caring for the patient. When that happens and the doctor's able to see it versus me telling him on the phone, oh, by the way, he's able to just make those snap calls. And like I said, the hospital stay ends up being better for the patient because they're not having to bring them into the ICU. They're not having to prolong that stay.
I was a nurse up north, and it wasn't a pilot program then, it was just how we work things. And that's what I was used to. So whenever I arrived here, it was kind of different. And then with the whole pilot program, it's like I'm home again. I feel like it works. You just have your doctors right there for you and to take care of the patients more efficiently.
Coming from a nurse's standpoint, because we're here every day and we see it, means so much to the patients. It makes everybody happier. The nurses are happier, the doctors seem to be happier as well, but the patients are the ones that are really benefiting from this. They get to see the continuative care with a doctor multiple days, which I don't feel the community really understands. Doesn't happen as much as we would love it to in the hospitals. But here we can actually do that and facilitate that.
It's working, you know. I can see already patients say, you know, I really appreciate how I can see the doctor. You know, the doctor walks into the room and I can ask questions firsthand to the doctor. I can also say that they appreciate that we're able to just say, okay, let me go ask the doctor that, and just walk over and have a conversation with them and get that clarification, and then just provide a better just patient-centered care approach.
Oftentimes I'd have family members or even patients themselves at my desk wondering when the doctor was going to come in, or wondering, you know, if they were going to see the doctor at all. And it's been great with the pilot because now I can say that the doctor is on the floor and that they could be in momentarily to speak with them.
So we had a patient that has been admitted to our hospital many times for a plethora of medical issues. Before we implemented the hospitalist program, she did not have a stellar experience. After, she had a wonderful experience. So it's obvious that this program is beneficial to our patients, and that's what we want.
Oh, everything has been positive. I ask each and every one of my patients that I take care of, how has their experience been here at NCH? Every single one that I've taken care of has had positive things to say. They really enjoy the physicians coming into the room, and they feel like they have more time with the physicians. Also, I feel like it makes my job a little easier because the patient is, happy with their care here.
The hospitalist is embedded on the unit. The hospital stays here all day long. At night we have a nocturnist dedicated to the patient care that we can easily get a hold of. And that's the biggest change here with the hospitalist embedded is we can walk right there when we need them. Not for our own benefit, but for the patient's benefit when something's needed for the patient. And it could be something little that, oh, I forgot I'm on this medication. Can we get that ordered? Or it could be when there's a critical situation going on and we really need to get a hold of a physician immediately to give us orders on how to treat the care.
This model of care truly is the best representation of our team working together for you in our community so that everybody can live a longer, happier, and healthier life.